me. Happy to thank the organizer to invite me to participate in this conference. So my paper is under the title of Risk Factors of Supplementary Suckling Technique in Infants less than 6 months of age with severe acute malnutrition in Yemen and Sudan. I am the main author and participated with me Associate Professor Aden and Professor Mohamed Salem. Globally, 3.8 million of children less than 6 months of age are severely wasted. In Yemen, around 20% of children under 6 months are affected by malnutrition, with 58.2% of stunting, 41.3% of underweight, and 14.3% of wasting. The nutritional status among children in Sudan was 24.9% of stunting, 15.4% of underweight, and 21.1% of wasting. Severe acute malnutrition is defined as a very low weight for less than -3 score of the WHO child growth standard median, or the presence of bilateral bleeding edema in infants who are less than 6 months of age. Today I will speak about simple technique that will make changes for severe problem in malnutrition. That's called supplementary suckling technique, which a method used to assist breastfeeding mothers who infants are unable to suckle effectively. It aims to re-establish exclusive breastfeeding in infants less than 6 months of age with severe acute malnutrition. High risk of severe acute malnutrition include infants too weak or unable to suckle, not getting satisfactory weight at home despite breastfeeding counseling, malnourished mother with insufficient breast milk, and lactating mother not available or passed away. The technique is constituted of a cup with nasogastric tube. The cup put it under the breast with milk, and the nasogastric tube lays near the navel of the breast of mother. So while the child sucking from the breast of mother, the milk flow through it. This technique, especially for those who has no milk or difficult problems available there. So after many times using this simple technique, the establishment of exclusive breastfeeding occurred. So the aim of the study to identify the associated risk factor of supplementary suckling technique in infants less than 6 months of age with severe acute malnutrition in Yemen and Sudan. The justification of the study: severely malnourished infants less than 6 months is a common problem associated with fatal outcome. There is limited information on this technique for those infants less than 6 months and no similar studies in Arab countries. It is a critical problem in Yemen and Sudan, and this technique will offer better advantages for the continuation of breastfeeding for economical point of view and psychological support. Our general objectives to study the risk factors of supplementary suckling technique in management of severely acute malnourished infants for both sex under 6 months of age admitted in Aden and Sudan. The specific objectives are to evaluate the outcome of supplementary suckling technique in management of severe acute malnutrition less than 6 months of age, to identify the risk factors to measure anthropometric measurement before and after management of this technique. This patient and methods that this prospective descriptive hospital-based study was undertaken between January 1st, 2018 through December 31st, 2020 in both domains in Aden and Khartoum. This is the protocol for supplementary second technique in infants. So mothers will consult for breastfeeding first and SST use. If infants fed with baby weight during SST, so either the weight loss continue for next days and insufficient breastfeeding. In this case, we will increase the therapeutic feeding formula, which here they use it F100 by 5 ml per feed. If there was or there is a regular weight increase in breastfeeding, so no need to increase the therapeutic feeding. And if wasted or the weight increased 20 grams per day for 3 consecutive days and no illness, you will decrease the therapeutic feeding. There is inclusion criteria. Infant less than 6 months of age due to failure of breastfeeding who were admitted for therapeutic feeding centers. Diagnosed based on definition of WHO criteria, that is weight for less than minus 3 score or presence of bilateral feeding edema. In addition, all mothers were unable to successfully breastfeeding at admission due to failure of lactation owing to stress of armed conflict that is available in Yemen and Sudan. And there is a big relation between Yemen and Sudan as the only Red Sea between them. So always immigration from here and there. And exclusion criteria, infants with known underlying organic diseases as acute of malnutrition were excluded. Any infants with congenital or chronic metabolic disease, infants had serious clinical conditions and clinical complications. So here we collect data collected and we use SPSS version 24 software of Windows and different tests. We found a total of 145 infants with severe acute malnutrition less than 6 months of age were included in the median interquartile grade age of 3 months. In the current study, the mean of some infants was 3.8 months. Minimum age was 1 and maximum 5.5 months, with a range of 4.4 months. Here, the flow chart, we rolled nearly 256. From them, 118 respond to this technique, to the supplementary second technique. Defaulters were 15, no response to, and died unfortunately 10. We found male more than female. It's 58.6%. Here, distribution according to the region in Aden was 19.3. In out of Aden was 15.2. In Khartoum 20.7. Out of Khartoum 4.8. Here we can see that the patient aged from 2 to 4 constitutes 66.9%. Here we can find non-breast constitute non-breast infants 24.8%, while partial breastfeeding, we mean by partial, that means using breastfeeding and artificial milk, constitute the major sample. It was 74.5%, and exclusively only 0.7%. Here we can see that mother's education illiterate 41.4% and primary school 40.7%. In relation to the occupation of the mother, 96.6% of them was housewife, and marital states 98.6% of them married. The income per month nearly 79%. Their income less than 100 US dollar. Here, according to the duration of stay in the hospital, we can see in the middle those between 2 to 4 months. The green one is the highest, and they stayed between 1 to 2 weeks. Here, distribution of study group using feeding by this technique by age group and weight, and we can see the mean weight before using the technique was 3, and after using it 3.4, which statistically significant. The cure rate for the babies who subjected to this technique was 81.4%, defaulted 10.3, non-response 1.4, death 6.9%. Here distribution according to the using of the SST in relation to age and duration of stay and outcome of supplementary suckling technique. You can see the cure rate. Those with age 2 to 4 months constitute 68.5%, and those defaulted nearly all of them less than 2 months. Similar to non-response, for non-response between 2 to 4 months, and those who died between 2 to 4 months also. So we conclude that severe acute malnutrition of less than 6 months of age is widespread in Yemen and Sudan due to food insecurity, economic crisis, illiteracy, lack of breastfeeding counseling, and internal conflicts. The major risk factor in this study were 8 to 4 months, partial breastfeeding, mother education, income per month of family, home displacement, work affection, and social class. Supplementary suckling technique provide those infants with therapeutic milk in order to initiate rehabilitation and establish exclusive breastfeeding through stimulating relactation. Those infants with diluted F100 and F75 therapeutic formula using this technique showed marked improvement in their weight gain. Improving and focusing on continuous breastfeeding practices effectively are highly recommended. The younger the child, the better the outcome, as the mother stays less in the hospital. We recommend that all children under 6 months of age should screen and monitor with vaccination at birth, 6 months, 6 weeks, 10 weeks, 14 weeks to prevent malnutrition and lactation failure as they go through vaccination centers. All mothers must know that breastfeeding is a perfect optimal nutrition for infants' growth in the first 6 months. Importance of exclusive breastfeeding package message should be taught by midwives, obstetricians, pediatricians, and prenatal care and postnatal care. This technique should be counseling in the curriculum teaching in paramedical schools for midwives and nurseries. This technique also the most effective, simple, easy to learn for lactation in infants has lactation failure. And this should be part of infants and young children feeding corner in the treatment of malnutrition in infants less than 6 months in the stabilization centers. This is Sydney, Aden, and Khartoum.